see, we have the only MPH program in the nation in which you can specialize in feedback. You can actually specialize in American Indian public health at North Dakota State University. And we have several wonderful programs that are underway. And what I wanted to talk about is what we're doing to try to integrate traditional American Indian medicine into the public health system. Well, this is a picture where I'm from originally. This is Kyle, South Dakota, on the Pine Ridge Indian Reservation. And the original name of this region is Pejuta Haka, which means medicine root in Dakota. And many of our traditional healers are from this area, including several of my uncles. But I'd like to start this discussion with a brief history of medicine. 2000 BC, here eat this root. 1000 AD, that root is heathen, here say this prayer. 1800, that prayer is superstition, here drink this potion. 1900, that potion is snake oil, here swallow this pill. 1950, that pill is ineffective, here take this antibiotic. And year 2000, that antibiotic is artificial, here eat this root. So we've kind of come full circle, haven't we? And it's interesting when we look at the way we used to live in a much healthier way. It's very different than the way we live now, unfortunately. This is a picture of the cafe in Kyle, South Dakota. And there's very limited healthy options. It's mainly breaded and deep fried food, unfortunately. Across the street from there is a gas station that also doubles as a grocery store. So again, very limited options for healthy food choices, mainly prepackaged and processed foods. And as a result, we have very high rates of preventable issues like diabetes and its complications. So if we look at North Dakota, the health disparities are just tremendous. The average age of death for the white population is 75.7 years, and for American Indians, it's 54.7 years. Isn't that remarkable? 21 years difference in average age of death. Well, much of this is due to preventable causes, things like diabetes. We have double the prevalence of diabetes for American Indians in this state, but we have almost 6 times greater rate of death due to diabetes. So we're not doing a good job in terms of preventing or treating type 2 diabetes, unfortunately. Well, this is one of my favorite old photographs. This is actually one of my ancestors from Pine Ridge, South Dakota, and he's a medicine man. And what we see here is very different than what we see in the modern clinic, isn't it? You can see he's touching the patient, he's praying with the patient, he's meditating with the patient, and the family and the community are all engaged in the healing process. And in truth, if we want to be effective in public health, we need to be good at engaging our communities in a culturally appropriate way. So one of the initiatives that we're moving forward is to look at how we can integrate traditional philosophy into this system of public health. So the preservation and advancement of traditional healing, or the PATH program. And many of our traditional healers really struggle financially because they can't get paid for their work as a traditional healer. That's kind of outside of what we do traditionally. So what we want to do is create a fund in which we would pay traditional healers to be traditional healers, and actually to take on apprentices and serve as mentors. And what we would like to have is an annual PATH conference in which the traditional healers and the apprentices can come together and learn from each other, and we can learn how we can better integrate traditional medicine, and this really is an effort at cultural preservation as well. So if you would like to join me on this path, please feel free to contact me anytime. Aho, pilame. Thank you all very much.